The KMPDC letter of suspension, they were not supposed to operate. And the committee coming out to verify the claims that has been put before us was to give them an advantage of defending themselves. Whether what they have been accused of is right or wrong, produce documentation so that we can sit as a committee and do a report. Our report is very lethal. It will either confirm what is going on here or not. But as you can see, two entities now, two facilities we have gone to, we found closed. And that is to their own disadvantage. I wish they could know better to wait until we interview them. But again, a committee and parliament operates with the power equivalent to the High Court. We will see what is necessary when we return to this facility to ensure that no person will supply hot air and siphon money from a public corporate like NHIF. That one we can assure Kenyans. And on behalf of the committee leadership, Dr. Pokose and the vice chair, we can unequivocally say that this mission is successful because we have known now what is going on here. And we have interviewed people around here and have told us what is going on here. So suspending a license may not mean suspending services which are being rendered illegally. So to this end, we are moving to another one, but I want just to say that this is the kind of services that Kenyans are getting in such areas and such environment, and claiming lots of money, which is not even plowed back to improve the facilities, as you can see the environment here. Unless one of my colleagues wants to add something, I think that would be it. Yes. Some of the issues, sometimes they get to collude with people from other counties. Especially we have had Meru County, Machakos County, and people they pretend to have brought those people here. In the actual sense, there's nobody. That's why I said hot air. Also, there are issues of workers having been treated here, but when follow-ups were quickly made by some entities, they found those workers were working in their areas of work and being treated at the same time. If you're a person, you cannot be in two places at the same time. So there's a lot of fraudulence and false claims to these facilities for services not rendered to Kenyans. Yes.
My name is from Nation. I'm curious to know, now that a hospital like Hamal Hospital has lost its doors in the committee, there's a tendency in this country of people starting other clinics under different brand names and just transferring and changing now that this license is suspended. How is this committee going to handle that?
Actually, that is the point. We are not only going after the facilities. We are going after those who license them as well, and those who are charged with the fiduciary responsibility to ensure that they are operating within the law. And that is those are the regulating bodies like KMPDC. So we are going for the overall, because as a committee we oversight everything, whether you license them or you are licensed and provide services. So they will not hide. And I tell you, people are suffering. This is true. And most people are dying from substandard intervention in medical field, meaning what is supposed to be done is not done according to what. Secondly, what is being paid is not done at all, which we refer to as hot air. So that is under the auspices of this committee. Nobody is above this committee because it's act like parliament, and I said at the level of the High Court. So whoever licensed you, if he licensed you wrongly, and you are not qualified, you did not qualify, we go for you. If you are licensed rightly and you are not doing what you are not supposed to do, then we will also come for you. And this is why we are out here today instead of sitting in parliament to do a committee meeting. Okay.
A huge number of patients under NHIF cover who are apparently claimed treated in this facility came from the same companies. An audit of the attendance sheets of those companies show that patients whose claims were lodged by NHIF here were on duty in the companies where they are employed and where their NHIF deductions are made. The visit and the recommendation by the KMPDC was for Amal to suspend its inpatient services. Conversations with the residents here tell us this facility was open yesterday and operating. That this facility earlier this morning was open and operating. And even when we are told, when we look at the door, this door is not secured. And the area is completely kept clean. This is not a deserted area. The Committee of Parliament has the power to summon any person of interest to appear before the committee. The owners of Amal will have to appear before Parliament, either voluntarily or through warrants of arrest. The choice is theirs. Secondly, the weaknesses in the system, both at KMPDC and also at NHIF, in terms of contracting and onboarding facilities, have to be straightened before the new laws begin to act. Because we cannot transfer the same weak systems in NHIF to the Social Health Insurance Fund. If we allow that to happen, as parliamentarians, we will have failed in our duty. And if that system is adopted as it is by the Social Health Insurance Fund, we will doing things the same way. We cannot expect different results.
We are finding is that most of these facilities were set up as special purpose vehicles, where you have surgeries which were never done, and yet they were claimed from NHIF. And that is why we are asking to know who in particular authorized for those surgeries. So that I think it's a high time that people were held liable so that they can be a lesson to other people. This country must change, and this committee is committed to cleaning up the health sector.
The media for having highlighted the issues that are bedeviling the health sector, and more so the NHIF through this kind of fraud. This hospital, when you look at it, it is indicating that they are both inpatient and outpatient services. In a hospital where you have those services, you have no reason at all to close it when you hear that parliamentary committee are coming around. Because where are the patients? If you close it that way, it means this hospital has no patients. So what justification do you have to make any claim? Because a hospital like this means, how did you remove even the patients that were supposed to be inpatient? Because somebody to be admitted means that person is not able to walk or is not able to go as an outpatient and get services. So this is supposed to be an inpatient facility, offering even maternity delivery. Where are those deliveries? Where are those mothers? Where are those patients? So this is the kind of fraud that we are saying it should not be encouraged in this country. It's a shame that a facility like this, Amal, people who open a facility kutekea pesa ya serikali ama organizations. Then once people come in to find out, is the facility operating? Are they offering these services? Because that is basically what we've come to do. We want to find out, is this facility open? Is it operating? Does it have patients? And that kind of thing. Now, the owners decide, close it down and run away. Then you ask yourself, where are the patients? Did the patients also run away? So those are the intricacies that we are facing in this kind of services within this country. And we want to ask the medical practitioners and dentist council, please, we can't have this kind of facility operating. And this should be, and any other facility within the country. The committee is here today, we'll visit other facilities. Tomorrow we'll be visiting other facilities. Then after that, we'll be traveling to Nyahururu, Nakuru, Eldoret. Then another team will be traveling to Embu and those sites to just find out whatever was being alleged. Is it true or it's not true? Thank you.
More Radio, 88.2 FM. are in charge.